Welcome to the Infection Prevention and Control Education Refresher on making routine practices routine in acute care. Why is infection control important? To protect your patients, visitors, yourself, your colleagues, and your family. In order to prevent harm, we complete safety checks prior to medication administration to avoid med errors. We follow protocols to manage MI or stroke. We ensure a patient at risk of falls has a bed monitor to prevent harm. This same attention should be given in order to not give the patient an infection during the delivery of care. Whether this is an antibiotic-resistant organism like MRSA or CPE, a surgical site infection, a UTI, respiratory, or GI healthcare-associated infection. Infection prevention and control is often overlooked because germs are invisible. You cannot see the transmission of germs or when someone unknowingly transmits an infection. Because germs are invisible, it's difficult to determine who exactly contributes to carrying germs from one environment or patient to the next, but we know that it happens. IPNC reviews every culture result collected in our region. Infections that were not present at the time of admission can be reviewed to see if they were caused during the delivery of healthcare. IPNC for acute care reviews all MRSA, CPE, C. difficile, and VRE bloodstream infection cultures specifically to determine if the infection is attributed to us. The results of these investigations and case reviews, as well as hand hygiene compliance rates, are reviewed regularly. With low hand hygiene compliance and increased infections attributed to the delivery of care, we need to really understand how to stop the spread of germs and be able to incorporate that knowledge into practice. Routine practices are the foundation for preventing the transmission of germs. The consistent use of routine practices is an expectation of care for all persons at all times and in all healthcare settings. For this presentation, we are going to review hand hygiene, the point of care risk assessment, and PPE use. What happens when IPNC principles are not put into practice? Infection control practices are designed to break the chain of infection and prevent healthcare-associated infections from occurring. Healthcare-acquired infections are one of the most frequent adverse events in healthcare. When a patient acquires an infection during the delivery of care, we increase our own workload. We increase the patient's length of stay, which can result in bed flow issues. It increases cost because of prolonged care, PPE, and antibiotic use. It impacts our already vulnerable patients, keeping them sick for longer. It increases their feelings of isolation. It can delay interventions and diagnostics. It can even increase their risk of disability or death. Why is hand hygiene so important? The most common way microorganisms are spread is on the hands of healthcare staff to our patients, either directly or indirectly during the delivery of healthcare. Consider the care you provide to your patients. We are constantly touching surfaces, patients, equipment, supplies, food, waste, and body fluids, and ourselves, our glasses, face, scrubs, hair, and watches. We use the washroom and we help others use the washroom. We eat and we help others eat. All of these can carry potentially harmful microorganisms that can be passed on to someone else or to ourselves if hand hygiene is not performed correctly. 80% of staff who dressed wounds infected with MRSA carry the organism on their hands for up to 3 hours. Within 30 minutes of contacting the environment of someone with C. diff, 60% of the hands of staff were contaminated without even touching the patient. 40% of all nurse interactions resulted in the same organism of Klebsiella pneumoniae being transmitted to healthcare workers' hands, lasting up to 150 minutes, even with contact as slight as touching the patient's shoulder. Hand hygiene is the most effective intervention for reducing healthcare-associated infections. It's fast, it's simple, and it's effective. So why do we continue to see low compliance? Your unit will receive quarterly and annual hand hygiene reports. They will be posted on your Viz board. It shows the compliance rate observed on your unit as well as the compliance rate of each profession observed. Auditors may provide feedback based on what they are observing during an audit session. We encourage you to go to your Viz board and have a look at your compliance. Hand hygiene in the external or healthcare environment. In the healthcare environment, there are multiple persons' flora or germs in the environment, including that of staff, visitors, and patients and clients. Therefore, when our hands come into contact with items in the external or healthcare environment, hand hygiene must be completed prior to handling items considered clean or coming into contact with a patient and/or their environment. Things that are part of the external or healthcare environment include common areas such as corridors, lounges, and nursing desks, and shared equipment in this environment, such as phones, computers, and charts. It also includes you, your glasses, uniform, stethoscope, pen, watch, swipe cards, and Voicera. Don't forget about exterior door handles and equipment that is not stored in clean zones, such as linen hampers in hallways. Hand hygiene and the patient environment. What is part of the patient environment? Items or surfaces in the patient room or bed space, including the patient, equipment that is in use or has been used on that patient, and any items that have been brought into the patient room and have been in contact with the patient or surfaces within that room or bed space. Items in the patient environment should only have germs or flora of that patient. Hand hygiene is required when you move from external environment prior to making contact with the patient or anything in their environment. Remember, hand hygiene is also required when you move between patients in a multi-bed room or common area. Hand hygiene and the clean aseptic environment. Anything clean can only be accessed with clean hands. There should be no germs on clean items. If all staff clean items appropriately and access clean supplies with clean hands, the items remain clean until they're used. Clean items or areas can include medication carts, med rooms, clean supplies in clean supply rooms, linens, meal trays, clean equipment such as wheelchairs and Dynamaps stored in clean zones. Clean or aseptic procedures include accessing drains, inserting or accessing Foleys or IVs, medication administration by any route, feeding a patient, pouring water, all require clean hands immediately before beginning the procedure. Once clean items enter the patient environment and touch surfaces or are touched by the patient, they are no longer clean. That is why single-use clean supplies from the patient room cannot be returned to the clean supply room or be used on other patients. Hand hygiene and contaminated or blood and body fluid exposure risk. Anytime there is a risk of exposure to blood or body fluid, consider it contaminated. Body fluids and contaminated items are very high risk for carrying a large amount of microorganisms. When in contact with blood or body fluids or contaminated items, you must do hand hygiene immediately before you contact any objects or surfaces, even within that patient's own room. Examples of contaminated items include used PPE, used tissues, soiled briefs and linen, garbages, floors, used urinals or commodes. Examples of body fluid exposure risk procedures include dressing changes, IV starts, IM injections, specimen collection such as urine, stool, sputum, or NP swabs, oral care, emptying a drainage system such as a Foley or JP, or changing a brief. Consider this example. After starting an IV and securing it in place, before you touch any other surfaces in the room, you must remove your gloves and perform hand hygiene to prevent the transfer of body fluids onto surfaces in the room. Think of the patient, visitors, and your coworkers. They should not be at risk of contacting surfaces contaminated with blood. Another example, you are in a contact precautions room and you perform oral care. You also need to perform a bed bath and peri-care. Do you wear the same gloves for all care in the room? No. Oral care is a body fluid exposure risk. Remove your gloves, perform hand hygiene, and don new gloves before contacting bed linens to prepare the patient to be washed.
Hand hygiene. More hand hygiene is not the answer. Doing it at the right time is. Let's go through some scenarios. A healthcare worker is sitting on the phone when they finish their call and see a patient in the hallway. They first wash their hands before touching the patient or their equipment. Even though the patient is in the hallway, any of their equipment is still considered patient environment. Next, a healthcare worker touches the patient but then reaches into her pocket and touches her cell phone. Before touching themselves, they must perform hand hygiene because a cell phone is considered external environment. It is not clean to the patient, and you don't want to transfer patient germs into the external environment. Finally, a healthcare worker has successfully started an IV. After completing the skill, before touching anything else, hand hygiene must be performed, as there is a body fluid exposure risk. Having supplies ready before starting the procedure can help prevent cross-contamination onto clean items or the patient environment. You may not always have everything you need, but if you recognize that you have contaminated something, clean it, and if it can't be cleaned, dispose of it.
Prior to every patient interaction, the first step performed by healthcare workers must be to complete a point of care risk assessment to determine the risk posed by a patient, a situation or procedure to yourself, to other care providers, other patients, and visitors. Measures for your PCRA are always in addition to routine practices, like hand hygiene or additional precautions when they're in place. Conducting a point-of-care risk assessment involves asking yourself a series of questions before every interaction to determine the risk of being exposed to a potential hazard. Could my clothes or skin come into contact with blood or body fluids? If yes, wear a gown. Could my eyes or face be splashed or sprayed with blood or body fluids? If yes, wear facial protection. Is there an airborne transmission risk, such as an airborne organism or an AGMP? If yes, wear a fit-tested, seal-checked N95 respirator. Could my hands be exposed to blood or body fluids? If yes, wear gloves. Is the patient on additional precautions? If yes, ensure that you're wearing all required PPE for this specific type of precautions. How do you know if there is a risk? Begin by thinking about how the patient condition can pose a risk. Are they showing signs and symptoms of infection, coughing, sneezing, vomiting, diarrhea? Are they on additional precautions? Are they cooperative? Are they able to perform hand hygiene? Can they cover their cough? Think about the tasks that you're performing. Will there be a risk of contact with blood or body fluids from secretions, non-intact skin, or mucous membranes? Think about the difference between taking vital signs versus performing a complex dressing change on a weeping wound. If the task has a risk for body fluid exposure, additional PPE should be considered. Determine the potential risk based on the environment in which care is being provided. Is the patient in a shared room or a treatment space with a shared washroom? Is there infrequent housekeeping? Does the environment allow for physical distancing from other patients? When the care environment presents a higher risk, additional PPE may need to be considered. Think about the degree of contact that you expect to have. Are you simply going in to deliver a meal tray, or will you be doing a lengthy procedure with the patient? Will you be providing direct care? Indirect care tasks are tasks that don't require close contact with the patient and present a lower risk of exposure. Direct care tasks requiring close contact involve a greater risk of exposure. For tasks or procedures that require direct, close, or prolonged contact with the patient, the risk of exposure is going to be higher and additional PPE should be considered.
If any point of care risk assessment factor is deemed high risk, the risk of contamination goes up. Take the appropriate measures to protect yourself and others. Stan doesn't do a point of care risk assessment. He goes in to examine a wound and doesn't wear gloves. Stan finishes his shift and goes home. The patient is transferred to another unit and Stan forgets all about it. 2 days later, the wound swab results positive for Group A strep, necrotizing fasciitis. Stan gets a call from occupational health, who is completing contact tracing to assess his exposure to the patient. Stan admits he didn't wear gloves. Stan now needs to go see his doctor and be prescribed chemoprophylaxis. Don't be a Stan. Don PPE just before the task it is needed for. Use the correct donning and doffing technique. Utilize shared health posters if needed. Avoid contaminating yourself and the care space by doffing and discarding PPE immediately after use. Low compliance is not only not wearing PPE, but it includes the improper wearing of PPE. For example, masks under the chin, gowns not tied and open in the back, incorrect donning and doffing, etc. Gloves are an integral piece of PPE in healthcare. However, we often see gloves worn for tasks they are not required for, or gloves worn in place of hand hygiene. Hand hygiene must be performed prior to accessing clean PPE and after doffing PPE. What can you do to protect your patients? Know when the right moment is to perform hand hygiene. Don't change a brief and then touch multiple surfaces in the room. You may have gloves on, but the patient, their roommate, and the staff coming in after you do not. Build hand hygiene into simple routines, like immediately before touching something clean and immediately after blood or body fluid exposure risk. Keep nails short and clean, no gels or acrylics. Keep hands moisturized to avoid skin breakdown. Don't put wet hands, either with water or ABHR, into gloves. One common task we often see healthcare workers performing with gloves on is pushing a patient in a wheelchair. The wheelchair should only have the microflora of the patient on the wheelchair, therefore they aren't required. If the task before pushing a patient in a wheelchair had a blood or body fluid exposure risk, such as getting a patient out of bed with soiled linen, gloves should be removed and hand hygiene performed prior to pushing the patient in the wheelchair. Gloves can impede our ability to perform hand hygiene appropriately, as seen here as staff touches her hair and then proceeds to touch the patient environment. This would be a missed opportunity for hand hygiene as the healthcare worker touches herself, external environment, and then touches the wheelchair, which is patient environment. When pushing a patient in a wheelchair, all that is required is clean hands prior to touching the patient environment. Visitors and designated caregivers have a responsibility to comply with routine practices. All staff involved in care are responsible to teach those receiving care and their visitors basic principles such as hand hygiene, respiratory etiquette, and use of PPE. Visiting policies must balance the risk of transmission of infectious disease and the promotion of patient-centered care. Exclusion of those with signs and symptoms of transmissible infections should reduce the risk. This can include not visiting when ill. However, if a visit is deemed essential, such as a parent or guardian, designated caregiver, or end-of-life circumstances, we must take steps to reduce the risk of transmission, such as wearing a medical mask for respiratory symptoms, performing appropriate hand hygiene, remaining only in the patient's room, avoiding contact with other patients, their equipment, and avoiding communal areas. We also must make sure those visiting can comply with infection control practices. All of us are responsible to keep our patients, visitors, and co-workers safe. Patients will have a limited ability to comply with PPE and hand hygiene if they are not provided the information and resources to do so. It's very important that we encourage and assist patients with hand hygiene prior to meals, after toileting, after blowing their nose, or wiping other secretions or wound drainage. We must also provide education to the patient if they are being placed on additional precautions. There are fact sheets related to MRSA, CPE, and every additional precaution to help explain and educate our patients. As explained earlier, isolation gowns and gloves are not required for the patient. If it is necessary for a patient on precautions to leave their room, patient should be in clean clothes or housecoat, have clean hands, all draining wounds should be covered and contained, and a mask should be worn if experiencing respiratory symptoms or if they are immunocompromised. Equipment cleaning and the environment. Thorough environmental and equipment cleaning is always important. For patients on additional precautions, it is imperative as these organisms persist in the healthcare setting. The environment and equipment is only as clean as you and your colleagues make it. If a vital signs machine is not cleaned after use, it has the potential to transmit infections to any further patients it is used on. If a nurse takes an IV tray into the room and places it on the bedside and proceeds to touch the patient and then reach into the clean tray, it will be contaminated for all further staff and patients who access it. If a healthcare aide takes a water jug out of a patient's room and refills that used jug in the clean kitchenette, that has the potential to contaminate the water dispenser for all further users. If education on the importance of hand hygiene and cough etiquette is not provided to a patient experiencing cough and runny nose, you can expect that the patient environment will be heavily soiled. If staff and housekeeping are not diligent in hand hygiene and routine practices, you can expect those organisms to be carried beyond the patient room. Everyone has a role to play in transmitting or not transmitting infection. Just because germs are not visible, it doesn't mean they aren't there. Surfaces and equipment become contaminated where healthcare is provided. Contamination occurs most often through touch by staff, patients, or visitors. Any single-use items brought into the patient room must be dedicated or discarded. In this video, the healthcare worker removes the equipment from the patient's environment, cleans her hands, and then accesses disinfecting wipes. She then cleans and disinfects the equipment, allows for adequate contact time. Finally, she returns the equipment to the dedicated clean zone. This must be done every time a piece of reusable equipment is used on a patient and then leaves the patient environment, not only on additional precautions. Hand hygiene is the single most effective way to prevent hospital-acquired infections, but compliance data is often low. Here we see the healthcare worker take a clean Dynamap into a patient environment. She neglects to clean her hands prior to touching the Dynamap and entering the patient's bed space. By not performing hand hygiene prior to touching the patient and their environment, she has put the patient at risk for an HAI. With the help of GlowGerm, we can visualize how neglecting to perform hand hygiene can transfer germs from the external hospital environment to our patients and their environments. If the staff member was in a room with a patient prior who had something infectious such as COVID-19 or norovirus, by not cleaning their hands before patient or patient environment contact, they would transfer those germs to the patient. Germs are invisible, so it's so important that we clean our hands to break the chain of infection. With the help of GlowGerm, we can visualize the transfer of germs onto the cup, the wheelchair, the blood pressure cuff, and finally the patient's bedding. While performing tasks that have a blood or body fluid exposure risk, wearing gloves help us protect ourselves. If we fail to doff our gloves and clean our hands following blood or body fluid exposure risk, we will continue to contaminate the environment with the blood or body fluids that may have been transferred to our gloves. In this video, we see two healthcare workers changing a patient's brief. The healthcare worker on the right completes the task and cleans her hands appropriately. The nurse on the left carries on with her tasks, failing to clean her hands, transferring the germs on her gloves into the patient environment. It's crucial we clean our hands following blood or body fluid exposure risk. The healthcare worker who failed to clean her hands after providing pericare contaminated the environment by adjusting the bed rail, changing the position at the end of the bed, and then touching the doorknob to the bathroom. With the help of GlowGerm, we can visualize how easily blood or body fluids can be transferred throughout the environment when we don't clean our hands. This contaminates the environment and puts our patients, our coworkers, and ourselves at risk. What kind of unit do you want to work on? Is it safe for patients? Is it safe for staff? Can you lead by example and provide reminders to colleagues? A common interpretation of culture is the way things are done around here. It is impacted by individual and group values, attitudes, perceptions, competencies, and patterns of behavior. I think we would all want to work on a ward where patients are isolated when they should be, hand hygiene is performed appropriately, and staff use clean equipment on their patients. Every person's attitudes and behaviors impact ward culture. In summary, know your environment. Think about what you touch and whose germs are on it. Do your point of care risk assessment to help keep yourself, your patients, and your coworkers safe. Clean the equipment you use to ensure it is safe for use on the next patient.